We're doing, and there are others working on, are antibody therapeutics. So you heard Deborah mention the importance of developing antibodies to protect a recovered patient. We can sort of skip that process and give a patient antibodies directly to protect them before they were exposed to the virus. So my team has just completed engineering of a set of extremely potent antibodies that bind to the evil spike around the virus and block those spikes so it's not able to gain entry into cells. And so we are going through the next set of steps, as are other groups. And most of them are talking about running human studies beginning towards the end of summer, and that would then set up the stage for reviewing the results to do follow-on studies and potentially start releasing by compassionate use protocols, therapeutics into the fall.
So your therapies are very promising for the end of summer, the fall period. If you have a patient who is struggling with this right now, would you recommend hydroxychloroquine and Z-Pak combination, since it is already FDA approved and is available to doctors by prescription?
So I would defer to the previous speaker that suggested using chloroquine. That was the protocol in China and South Korea, and it seems like that's the protocol that's being applied here for severe cases. Again, I would like to see more results on data. We're basically right now we're throwing spaghetti against the wall to see what sticks. There's some reasons to think chloroquine can help, but it would be nice to have some more data. We know that it's not a perfect cure-all, because otherwise we wouldn't worry about these patients anymore. So more medicines still are needed.
So what's your message to people to avoid this at this stage of the game, as we see this wave kind of building across the country at this point? 20 seconds.
Yeah, so my message is two parts. For people who aren't taking this seriously, you need to start. This is a serious disease. This is much worse than influenza in terms of both infectivity and in terms of mortality. So there's no real group that's safe. Although children are largely spared. So for your own health, and then for the health of those around you, please start taking these things seriously. And I think that group is going to take care of itself once we move into April and this gets serious.
Dr. Jacob Glanville, good luck with your work. We are all counting on smart people like you to help us figure this out as soon as possible. Dr. Jacob Glanville, thank you. Good to see you, sir.
Thank you.
So very pleased that joining me now is another member of the White House COVID-19 Task Force, the United States Surgeon General, Dr. Jerome Adams. Dr. Adams, thank you so much for being with us today. Good to have you here.
Hello, Martha. Good to be here.
I want to get right to the questions that are coming in from our friends at Facebook. This one is from George Perez, who is a grocery store manager in New York. Let's hear from George.
My name is George. I'm 38 years old. I run a supermarket over in Long Island City, and I appreciate you guys having me here today. The main reason I'm here is because I am concerned about my employees and our customer safety. So I was hoping I can get some advice as far as what I can do to keep them safe and healthy, not just physically, but mentally.
Oh, thank you, George. That's a loaded question. We all are still going to the grocery store, Dr. Adams. So what do you tell the good people who are in there stocking the shelves, and also those of us who are going in to get things for our families?
Well, that's a great question from George, and it's one that I get and that I actually personally live through. I still go out and do my own grocery shopping. Yeah. I would say from a mental perspective, it's important for people to understand that 80% of people who get COVID are going to get mild symptoms. 98 to 99% of people are going to recover. From a physical point of view, it's important to know that staying 6 feet away from the nearest person is important, whether you're a customer in the grocery store or whether you're stocking shelves. We know that the virus can live on surfaces for a certain amount of time, and so it's important that you frequently hand wash and that you avoid touching your face, so that if you touch a surface that someone else has sneezed or coughed on, that you don't bring that to your face, to your mouth, to your nose. Most important things you can do: hand hygiene and social distancing.
So I have another question, because this is something that I've spoken to my friends about. When you bring your groceries home, right, how do you treat them? Do you spray them? Do you wipe them off before you bring them into your kitchen? What do you do?
Most experts don't recommend that you have to spray them or wipe them down, but I'm just going to be honest with you. When I go grocery shopping, I lay out my groceries on the table. I leave them there for several hours to the extent that I can if they're non-perishable. because we know that the virus can live for a few hours, but the longer you leave it out, the less virus there's going to be on it. And anything that's perishable, before I put it in my fridge, I wipe it down or spray it down. So better safe than sorry.
That's good to know. It is very good to know. So, you know, his question also touched on mental health, and I felt so inspired by the people who are working in the grocery stores. They're very upbeat. They're trying to stay positive as they work. What advice do you have for him, for his employees on that front?
Well, my advice is actually to the people who are coming into the stores. Now more than ever, it is important that you say thank you. Yes. Thank you to that delivery driver, to that grocery store worker, to the person in the hospital who you run into, who are all out there, quite frankly, putting their lives on the line to make sure you get what you need. And again, reassure those people that we're doing the right things with social distancing to ultimately get to the end of this. We've seen California and Washington bend their curves, and most people are going to get mild symptoms if they do get COVID, and 99% of people, based on other studies, are going to recover.
All right. Let's go to the next question. This is from Cassie Clear. She's a nurse in quarantine because she's pregnant. Cassie.
Hi, yes. So I've heard many hospitals aren't allowing their significant other in for the delivery of their child. Now, this would be terrifying for me, especially it being our first. And being a nurse, I always think worst case scenario, if something were to go wrong, that would be devastating. Luckily, I'm not due until September, so I'm hoping it's all over by then. But what do you think? For me, like mental health standpoint, I would think the benefits outweigh the risks in this case, but do you recommend hospitals denying the spouse or support person there for the delivery, or do you think the benefits outweigh the risks?
Doctor.
Cassie, great question. Important to know that my wife has had 3 high-risk pregnancies. I know how important it is to have someone there with you. Here's what I say to pregnant women, and I actually get this question all the time. I got it just yesterday. Number one, more important now than ever that pregnant women do everything they can to stay healthy. That includes getting your vaccinations. That includes eating right. That includes exercising to the extent that you can, as long as you're social distancing while you do it. Important that you talk to your provider or your hospital and come up with a birth plan. And we've always told people to do this, but have that conversation about, okay, what if I go into labor in the middle of the night? What's going to happen? Who can come with me? What's going to be the procedures that we're going to go through? And when you have that figured out early on, then that makes it more comfortable and less stressful for you when you're going through it. Every hospital is going to have to make the best decisions based on their ability to meet needs. I really would encourage hospitals to do everything possible to allow at least the father or the significant other of the person to come into that room with them. But we have to understand that if you're in a place that's being hit really hard, and they may have to make a tough decision about what's safest for you and your baby. We hope that decision doesn't come, but it's better to have that conversation up front so that you're not surprised and that you have a plan.
All right. Let's go to Dee Dee. Thank you so much. Let's go to Dee Dee Chisholm, who's an executive director of a wellness clinic. Dee Dee, hi. Thanks so much for being with us tonight.
Good morning. Good morning. Evening. Good evening. Sorry. My question is, we have a moderate-sized multi-specialty practice in Denver, Colorado, serving OBGYN and family medicine patients inside our clinic. So right now, in our clinic, we are seeing our healthy patients. We are seeing all of our sick patients outside in a drive-through clinic in our parking lot. We have grown from 0 to over 50% telemedicine in the last 2 weeks. How can a practice such as ours prepare well, be solvent as a practice, protect our staff while we deliver exceptional care in the coming weeks and months?
Dee Dee, great question. And I'm so glad you mentioned telehealth. CMS, the Centers for Medicare and Medicaid Services, has really tried to do a lot to enable and empower telehealth, not just in rural areas, but in urban areas and in different settings so that people can get paid for it. Many of you may have heard that I have been saying for weeks people need to pull down elective procedures or non-urgent procedures so that you save resources and manpower to respond to everything else that's going on. And the most important thing I can tell practices is don't forget about anyone. That environmental services worker, the people who are in the cafeteria, the people who are at the front desk, everyone needs to get training on how to protect themselves and others from COVID-19 so that they aren't spreading it to other people within the hospital, but also so that they feel secure, so that they feel confident that, hey, I know about the disease. I've been told how to protect myself. I've been told how to protect others. But kudos to you and your practice for really being at the forefront of innovation, because that's what's really going to get us through this, lowering those face-to-face contacts, using telemedicine, and really engaging and empowering technology to be able to still meet people's needs.
Doctor, while Didi's with us, I have a question related to her question and all healthcare workers. Wouldn't it be just such a load off their mind if everybody could have that finger prick blood test so that they would all know whether or not they already have the antibodies, and they could sort of separate the people who do and who don't?
Important for people to know that if we can get that antibody test spun up, and many universities are actually doing this. I know that out in California, I talked to one of my docs out there who said that they're doing it for all of their emergency room doctors. That will help us decide, okay, you've been exposed, there's a very low chance you will be reinfected, we can put you on the front lines. That's different than testing people up front. And it's important to know that just because you test negative today doesn't mean you're going to test negative tomorrow. So we still have to follow proper precautions.
Great. Dr. Adams, thank you so much. And I also want to thank Didi for her great question coming into us and wish her the best of luck with all of her patients and her practice. Dr. Adams, thank you. We appreciate you speaking with everyone today. Good to see you, sir. Best of luck to you as you move forward, and we all do together.